Well, actuaries may not be the most exciting of professional categories, but they are often among the most trusted. And today, the Actuary Society, the group of actuaries that handle insurance and other estimates, came up with a pretty stunning conclusion about the impact of President Obama's health care law, the Universal Health Care Act. And that was that it's going to raise the cost of individual policies, insurers' individual policies, people who don't get their insurance from employers but who have to go out into the market under the law and get their own, that the cost increase would be about 32%. And it's going to vary widely across the country, as much as 80% in Wisconsin, Ohio, much lower in other areas of the country. Now, the variations depend on the number of people in a population of a state who currently don't have health insurance or who aren't currently about to go and get an individual health policy. So in states where a large majority of the population gets their insurance already from their employer, the effect on insurers is going to be much less. For those who get their insurance or have to go out and get the insurance themselves, where there are large risk pools and places like that, you're going to see much larger increases in the insurance costs. And that particularly is the case in the Rust Belt in Wisconsin, Ohio, and other places where there's a significant number of self-employed or people who used to have jobs in the manufacturing sector elsewhere now don't get their insurance that way any longer. So, and this is a trend that's going to continue. 32% increase in premiums. If the insurance companies absorb that, there's a lot of belief that in the end that consumers will absorb those costs, that they'll be passed on in the form of rate increases and other things. So as we begin to roll out this law and try to understand its consequences, one of the areas we're going to have to watch is the cost of rising premiums, rising insurers' costs to insure people who buy policies individually to get their health insurance on their own. We'll be keeping an eye on this at Washington Guardian and hopefully be able to provide you more insight over the next few months as new information comes out. One of the things we're certain of is that this study had an instant impact inside the White House. The White House trumped out HHS Secretary Catherine Sebelius to immediately talk about this and say, listen, it's going to vary from states and this is only a projection. But actuaries get paid to be pretty precise. That's how insurance and financial companies make their estimates and how life insurance policy payouts are derived. And a lot of people are saying that this was a pretty careful study and that 32% may be a number that America will have to learn to live with.